what are the best approaches to address these issues. And I think there are some areas, one which I just was describing, looking at mandatory professional development for providers. I think if we don't mandate this type of work, whether it's through funding or through specific guidelines in our organizations, it's very rare that the work happens just because the organization wants to do the work. No, so I think there has to be very specific guidelines to mandate anything that has to do with professional development or training related to this topic. The second important area here is to also to monitor, because even though, for example, many of the HRSA USED programs, we have a specific mandate around cultural competency, how are we actually monitoring how the funding is being used to address disparities and inequities, or what research programs are doing? I think looking at how we monitor that these things are happening in a culturally responsive way. And I think one of the most important pieces is looking at future research in this field. There are big gaps in research, specifically looking at disparities, health disparities, social educational disparities. And a couple of important pieces about research is that first, we need to ensure that all communities are involved in research. We know historically we know that, for example, racial minorities are underrepresented in any type of research, whether it's health or mental health research. That's one piece. And then when we do research, we have to ensure that research happens with communities and not in communities, which is a very different concept. No, it has to be in a participatory way, and we have to use approaches that are community-based participatory approaches. Having traveled to almost 25 states in the country and talking to parents in different states, some of the concerns I've heard from parents, and being a parent myself, doing this work, are distrust, with providers, distrust with organizations, historical issues with the specific institutions, So the more we build or rebuild that trust with communities, the more we're going to be able to have research that is culturally responsive and informs our future work.